Have you been approaching this the wrong way all along? Could standing up to pee actually be doing more harm than good? I'm Dr. Ryan Carter, a specialist in urology and men's health. Today, we're going to clear up a surprisingly common debate. Should men urinate sitting down or standing up? A large global survey asked over 7,000 men in 13 countries about their bathroom habits. In the US, about 10% said they always sit. Around 31% said they never sit, and about 17% admitted they rarely do. In Germany, however, nearly 40% reported sitting every time. Interestingly, older men were more likely to prefer sitting. So yes, many men do sit to urinate. But here's the real issue. Is one position actually healthier? Let's look at what your body is doing in both. Generally speaking, your pelvic floor muscles are more at ease when you sit. When you stand, those same muscles are often engaged to help with posture and balance. But to pass urine smoothly, those muscles need to let go so the urethra can fully open. I regularly see men whose pelvic floors are tight or overactive. There's no infection, no blockage, just tension. It shows up as trouble starting, a broken or stop-and-go stream, the sense of not being fully empty, pressure or discomfort when sitting, and even pain during sex. Think of it this way. Some people hold stress in their shoulders or jaw. Others carry it in the pelvis, and it shows up in the restroom. For men with this issue, sitting often helps because it naturally encourages relaxation. Now there's another piece to the puzzle, the prostate. After age 50, about half of men experience benign prostatic hyperplasia, simply an enlarged prostate. By 80, that number climbs to about 80%. As the prostate grows, it narrows the urethra, the tube urine passes through. Imagine sipping through a big smoothie straw versus a skinny coffee stirrer. The bigger the prostate, the tighter the straw. What men notice is straining to start, waiting for flow, dribbling afterward, a longer time on the toilet, and weaker pressure overall. And here's where sitting can really help. With a weak or messy stream, standing and aiming gets frustrating. Sitting can reduce the stress and keep things tidier. Research backs this up. One study compared men with prostate enlargement to those without. Among men with enlargement, sitting improved flow speed, increased total volume released, and reduced the leftover urine in the bladder. In simple terms, they urinated faster, more completely, and with less effort while sitting. For men without prostate issues, those benefits didn't really show up. So, if you're over 50 or dealing with urinary symptoms, sitting could genuinely help you empty better. But what about men without symptoms? A smaller survey of almost 200 men in the US found that about 18% still preferred to sit. Those men were more likely to have at least mild symptoms, recent surgeries, back problems, arthritis, or balance concerns. Some chose to sit at night to avoid making a mess, while others simply found it more comfortable. A few even reported that sitting gave them a smoother flow. One caution: sitting can tempt you to scroll on your phone or read. That's not a great idea. Extra time on the toilet increases your risk of hemorrhoids. The best routine is simple: go in, empty, and leave. So let's bring it all together. If you have no urinary problems and like to stand, there's nothing unsafe about it. If you prefer sitting, or if symptoms make sitting easier, that's perfectly fine too. For men with enlarged prostates, tight pelvic floors, or weak streams, sitting may actually be the healthier option. There's no gold medal for standing and no embarrassment in sitting. The right choice is whatever helps you empty comfortably, cleanly, and with the least effort.
A few practical tips. If starting is difficult, pause for 2 deep breaths and consciously relax your belly and pelvic floor. If you think tension is the issue, try this. Sit quietly for a minute, stand and walk a bit, then sit again. At night, sitting can reduce strain and avoid a messy bathroom if your stream is weak. If you snore heavily, wake up unrefreshed, or need frequent nighttime bathroom trips, ask about sleep apnea. Treating it can often cut down those late-night urges. If you notice blood in your urine, burning, fever, sudden pain, or an urgent change in symptoms, see a doctor promptly. Bottom line, the right way to urinate is whichever position helps you empty fully and comfortably. Standing is fine for many. Sitting is better for some, especially older men. those with prostate issues, pelvic tension, or balance challenges. Your bathroom, your choice. And if you want to go a step further in supporting men's health, there are natural supplements worth considering. I often recommend organic watermelon extract, rich in L-citrulline to support circulation and nitric oxide. Another option is a blend of Tonkat alley, fenugreek, nettlemoot, and citrulline formulated to support stamina, testosterone, prostate health, and sexual performance. You'll find helpful links in the comments and description.